Question number 9, Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he stand by all his answers to oral question number 7 yesterday?
Mr Speaker.
Honourable Tony Ryle.
Yes, Mr Speaker, in relation to a question about a 4-month-old letter, yes, in context.
Mr
Supplementary
Speaker.
question, Honourable Annette King.
Well, in light of that answer, had he read the letter written by the Chief Financial Officers of DHBs copied to the Ministry of Health, expressing their grave concern and collective concerns about his flagship finance procurement supply chain program, stating their confidence in the program had been severely diminished and that there were mounting risks to the delivery of health services before answering question 7 yesterday?
Honourable Tony Ryle.
Mr Speaker, no, but I'd been aware of the concerns that have been expressed, and I think the member needs to focus on the big gains that are to be made from this program. DHB spend about $1.4 billion a year on medical supplies, and if we can make a 10% saving in that over time, that's a very significant amount of money. It's a very important project.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Thank you, Mr Speaker. Will the National Procurement and Supply Chain Program be rolled out to the 20 DHBs from the 1st of July 2014? If not, why not?
Honourable Tony Ryle.
Mr Speaker, parts of the program are already being rolled out and are in place in Hutt Valley, and a lot of work has been done to put the platform in place. I have asked or encouraged the Health Benefits Limited to slow down some of their programs in order to ensure DHB buy-in and to have confidence for the whole sector about the implementation process.
Point of order, Mr Speaker.
Point of order, Honourable
Mr Speaker, my question was, will it be rolled out to the 20 DHBs on the 1st of July 2014?
I'll invite the Minister to add to that answer.
Mr Speaker, yes, it will be rolled out across the 20 DHBs, but it's always been the plan that it would be rolled out over a number of years. I think the member is behind the 8 ball here. And we have to focus on generating the savings that we need that can be reinvested back into health. One example, Mr Speaker, is non-sterile gloves, where the 20 DHBs had 18 suppliers, but there are only 2 manufacturers in the whole world. And by using smart procurement, we're now saving $6 million in that area.
Well done. The Labour don't care about that.
Supplementary question, Honourable Annette King.
How can he claim there isn't any risk to continuing services of frontline services and DHBs, as he said yesterday, despite the warnings from the Chief Financial Officers and the PSA, who estimate up to 1,000 people will have to move or risk losing their jobs because of his flagship program?
Honourable Tony Ryle.
Well, Mr Speaker, a lot of questions in that one. I'd have to say that I don't think services are at risk. I think services are improving year on year. Despite a doubling of the health budget during the 2000s to 2008, elective surgery flatlined. Under our government, services have improved dramatically, that 40,000 extra patients a year are now getting hips, knees and other elective procedures.
Supplementary
Speaker?
question, Honourable Annette King.
Why did he allow HBL to establish its own Oracle R12 computer system at the cost of millions of dollars when the 4 northern DHBs already run the Oracle R12 as a shared service which could have been used across the DHBs across all of New Zealand?
Honourable Tony Ryle.
Mr Speaker, I'm sure the member will find that Oracle is being rolled out across the country and is incorporated in the work of those northern DHBs, because that's part of this program. It's not all of it, it's part of this program, and it's important to be able to capture the purchasing information so you can get the big discounts, because some of those discounts that we've been able to negotiate are pretty significant. One of the providers of catheters, we've been able to negotiate a 14% 15% national discount, and in another, with a provider of infusion pumps, we've been able to negotiate a 22% discount for some of the supplies that they provide. So this is all about releasing cash that can go into improving frontline services like the faster emergency departments, the faster cancer treatment and the better preventive health care.
Good work.
Point of order, Mr Speaker.
Point of order.
I seek leave to table a letter from a member of the public who have advised me about Oracle R12 and the waste of millions of dollars by HBL.
Just describe the, leave us sought to table this particular email. Is there any objection to it being tabled? Supplementary question to your... Oh, just a moment, I need to put the leave us sought to table. It's no objection. It can be tabled. To your level.
Thank you, Mr Speaker. To the Minister, does he consider that a wise use of the additional $500 million invested in the health sector that he reported on in yesterday's question time would be to identify a broad goal of eliminating the intake of sugar-sweetened beverages as promoted in today's policy brief of the New Zealand Beverage Guidance Panel, and if not, why not?
Honourable Tony
Oh
Ryan.
no, despite the commitment of the Labour Party to introduce a broad-ranging sugar tax made at a meeting at lunchtime today...
Order.
Point of order, Mr Speaker.
Order.
I require
this
that
is
member...
Order.
Point of order, Mr Speaker.
This is a point of order.
I require that
hear
member to authenticate that answer he's just given.
That's not a point of order.
Mr
It's a
Speaker,
debating issue.
That's their secret policy. Mr Speaker, the government's opposed to a sugar tax. We don't think it will work. It's a tax that everyone will pay, even though it's designed to influence the behaviour of some. And it will be very costly, as being proposed by the opposition, because it will mean people will pay more for tomato sauce, more for honey, more for jam, more for the cost of living, when actually on this side of the House we think we should be keeping taxes under control and providing more opportunities for families to spend their own money. We don't think the nannies opposite should get their hands on the tax levers.
Question number 10, Julianne Genter.
Thank you, Mr Speaker. My question is to the Minister of Transport.